Hi, I'm Rebecca Deardorff, and I'm going to be presenting my presentation on adopting electronic health records. So, why are they so important today? Technology in general has become so important in modern healthcare, so of course, electronic health records are essential as well. But they do help improve documentation, communication, patient care, and patient safety. They support both regulatory compliance and quality improvement initiatives, and it is important for providers, including nurse practitioners, in managing patient care. So, there are 6 steps in implementing electronic health records. Step 1 is to assess your organizational needs and readiness. So, you're not only going to want to assess your organization, but also your providers and determine the goals of the new system and kind of what you want the system to do. So maybe look at your old system. What do you want to change from that? What was not working? And kind of go forward with the new system that way. Step 2 is to plan. So you are going to review your workflow, the system that you have right now, kind of look what isn't working. Can you use that to help you design a new workflow? You're going to want to also in this stage determine a timeline when you want to go live with this new system, and then also create a budget. Step 3 is to go ahead and select the new electronic health record system that you want to use. So there are a ton of vendors. You just want to sit down and compare and contrast which one might be better for your organization and your providers, your patient population, and then you obviously want to choose the product that best meets your organizational needs. And then step 4, you're going to go ahead and start preparing. So during this stage, you can start transferring patient data over from your old system. This is kind of when you're going to want to make sure that the technology is up and working properly, and you can go ahead and start pilot testing during this step as well. And then for step 5, you're going to go ahead and start training and testing the technology. So you want to train staff and make sure that they're comfortable using the new technology. And then you also want to continue testing the technology itself and make sure there are no issues. This is probably during this stage when you'll start to hear some feedback, and then you can kind of change things along the way as needed. And then the last step, you are going to launch your new system, and then of course just continue analyzing. So you're going to go live, monitor the technology, encourage feedback from patients, providers, other staff members, and then make improvements as needed. System comparison, it is important to compare the systems to kind of determine which one fits your organizational needs the best. So the 3 systems that I chose to review are Athena One, Epic Care, and eClinicalWorks. And while I was kind of comparing these organizations, these systems, I looked at things such as the size of my organization, how easy it is to use, training and support that is offered with the system. Things that come along with documentation, are there templates, is it customizable, and then of course the cost. The first one that I reviewed was Athena One. So some pros of this system are that it is efficient and fast to use. It is customizable. There are several built-in features, and they have great customer support. A few cons of this system is that there are frequent crashes. Some people report that it is complex to navigate. There are billing issues, and then instead of it maybe just being one upfront cost, that it does require ongoing cost. Another system that I reviewed is Epic Care. People have reviewed that it is user-friendly. There are diverse healthcare tasks, so the nurse practitioner, social work, lab, PT, OT, several different careers in healthcare can kind of look at this. The interoperability is good, and that there are custom layouts. And then some cons with this one are technical issues. People have reported excessive clicking, frequent updates and changes, which is just constant new learning, which isn't necessarily a bad thing, but can be difficult. And then there are a lot of features, but people have also reported that it is overwhelming having that many features. The last one that I chose to review is eClinicalWorks. Some pros is that it is financially appropriate. There's coding assistance, real-time error detection, and centralized patient data. And then cons of this system are the complex features, slow response times, inconsistent support, and then limited customization. I chose Athena 1 to be the best system for my organization for a couple reasons. It is a cloud-based health record system, meaning that providers can access the patient's records securely anywhere as long as they have internet access, so they don't necessarily have to be at the clinic or the hospital. It's also very user-friendly, which is good for not only the providers and the staff members, but also the patients who are going to be using that. That can help them get onto their patient portal. They can schedule appointments. They can request refills for their prescriptions. They can access all their healthcare records right there from their phone or electronic device at home. It also is very suitable for providers. They have several templates that you can utilize for SOAP notes, documentation. You can customize your progress notes with e-prescribing. They have controlled substance prescribing support and built-in medication management. When you are entering orders, there is built-in clinical decision support and lab and diagnostic order templates. And then there are also patient visit templates. So whether it's a sick visit, just a routine follow-up visit, something like that, there are templates that can guide you. So summarizing this, during this presentation, I have learned that to be successful in implementing a new electronic health record system, a lot of planning and training is required and goes into it. You should look at your organizational needs and your provider needs when choosing different systems. Each system, of course, is going to have pros and cons. It's important to sit down when you're trying to find a new system and determine what pros outweigh the cons for your organization, and then choose the right system for you. And then, of course, of the 3 systems that I evaluated, I chose to go with Athena 1 because I thought that it appeared to be the best choice for my current organization. And really just the overall use and importance of electronic healthcare records, why they're so important, why they're so widely used today, and it is because it does improve documentation, patient